Hello, and welcome to our 2014 Open Enrollment tutorial. To enroll for 2014 benefits, click on the 2014 Enrollment menu option or on the As Easy as 1, 2, 3 graphic. Please note that for your security, this website has an automatic session timeout after 30 minutes, which means if you are not done in 30 minutes, you will automatically be logged off. Please make sure you finish the form or save it periodically so you don't lose your information you've entered. Once the 2014 Election of Healthcare Benefit form loads, select a coverage level election. Remember that the election you choose during open enrollment will remain in force for the entire calendar year. You can only make mid-year election changes if you experience a qualified life event, as detailed in the Special Enrollment Rights section of the Enrollment Guide. To enroll for coverage, choose from one of the first of the 5 enrollment options listed. If you wish to opt out for benefit coverage in 2014, click on the option that states, "I do not choose coverage for myself at this time." Just be warned that you will not have any benefits, including short-term disability, also known as time loss, in 2014. Please note that many employers require an additional co-premiums, and this amount may be different for you. Check your collective bargaining agreement, also known as your union contract, or speak with your human resource department to verify your weekly pre-tax deduction. Next, check the boxes to confirm your dependent relationship, or if you or a dependent have other insurance coverage, such as through another employer, through a spouse or a parent, or if you or your dependents have Medicare coverage. Once you've made your selection, click on the Proceed button to get started. Your name, address, and phone number on file should be listed under the Employee Information section of the form. If any of your census information is incorrect, please make a correction. Remember to answer all of the fields, including gender, marital status, and answering the smoker question. Just as a reminder, the smoker question is for informational purposes only and will not be used to determine and apply terms and conditions of coverage. To enroll a dependent, click on the New Dependent button and add your dependent's name, social security number, date of birth, and gender. If your dependent does not live with you, please provide his or her alternate address. Click on the Update button to complete the addition of your dependent. If this is the first time you are enrolling a dependent, you must provide the fund office with the marriage license if this is your spouse, or birth certificate if this is your child. Note that other documentation to support your relationship or responsibility to provide coverage may be necessary and will be requested in written form by the fund office. If you have more than one dependent, follow the same step to add your second or third dependent. Once you've added all dependents, select the checkbox next to each dependent's name to enroll them for coverage. Only dependents selected and highlighted in yellow will be enrolled for 2014. When enrolling a spouse, you must complete the Spousal Coverage Verification and Working Spouse Fee section. Enter your spouse's employer, address, and phone number. Select one of the choices in the spousal coverage information that apply to your spouse. If your spouse works, but is not eligible for coverage at this time, enter the date when your spouse will be eligible for the coverage. You must contact the fund immediately upon your spouse becoming eligible for coverage. Please refer to the 2014 Open Enrollment Guide to find out when the working spouse fee applies to you. If you or a dependent are enrolled in Medicare, click on the New Medicare Information button to add the policy information. If more than one person is enrolled in Medicare, you must follow the process for each individual. Enter the enrollee name and Medicare ID number as it appears on the card. Next, enter the effective date of each Medicare section that applies. Part A is for hospital coverage under Medicare. Part B is for medical preventative coverage under Medicare. Part D is the prescription drug coverage under Medicare. ESRD is the onset date of the end-stage renal disease. Click on the Update Changes to save the Medicare information you've entered. Make sure your name appears under the Medicare information section before continuing. If you or your dependents have other health insurance coverage, select the New Insurance Information button to enter the other insurance information. First, start by entering the subscriber information. This is the employee who is the policyholder of the insurance. This could be you if you have coverage through another employer, or your spouse, or parent. Company name is the name of the other insurance carrier, such as Blue Cross, Aetna, HAP, United Healthcare, or Cigna, just to name a few. Company phone is the customer service number listed on the back of the other insurance carrier's ID card. This is used to verify coverage so that the benefits can be coordinated properly between both plans. Policy ID number refers to the ID number that is listed on the other insurance carrier's card and identifies the policyholder. The effective date is important, so please make sure you enter a correct date when coverage with the other insurance carrier started. Next, indicate the type of coverage the other carrier offers, such as medical, dental, vision, or prescription drug. If you're covered under this other healthcare coverage, please check your name and enter the effective date. Note that sometimes the policyholder and dependents may have different effective dates, so it's important to enter the effective date that applies to your coverage in this field. When complete, click on the Update Changes button to continue. If you or your dependents have coverage under another policy, follow the same steps again to add the other health insurance information. Make sure that the other insurance carrier is listed under the Other Health Insurance section before you click on the Proceed button. Next, you must check all 4 boxes in order to certify that 1. You've read the 2014 Open Enrollment Guide, including the Special Enrollment Rights section. 2. You certify that the information on the form is true to the best of your knowledge and beliefs. 3. You certify that you understand that you have the right to elect coverage for yourself and dependents at this time, and that if you fail to do so, you will not have another opportunity until the next open enrollment period. 4. You authorize your employer to deduct the applicable weekly co-premiums on a pre-tax basis out of your paycheck. Once you check all of the boxes, scroll down and click on the Proceed button. This is the last step of the enrollment form. You now have a chance to verify all the information you entered before submitting the form. If any information is incorrect, click on the Change link to the right of the section that you need to correct. Once you've reviewed and corrected all the information, you have the option to print your verification page for your records or click on